One contemporary health issue that I'm going to focus on for this presentation is sexually transmitted diseases. We're going to be talking about the risks, prevention, treatment, and more. So a sexually transmitted disease may be spread through any bodily fluids. It's a disease or infection that can be transmitted through sexual relations and contact, hence why it is called a sexually transmitted disease or an STD. Some of the risk factors are unprotected sex, history of STIs, more than one sexual partner at a time, forced sexual encounters, and then other than sexual encounters, it's going to be taking drugs by injecting them, hence the needles, and the men who take drugs to help with erectile dysfunction often also contract STDs or STIs. Some of the symptoms are pain while urinating or during sex, rash, bumps, and or sores, unusual discharge or bleeding in both women and men, pain in lower abdomen, fever, and sore or swollen lymph nodes. So some of the prevention, first of all, is to abstain. The second would be to stick to one partner at a time who has negatively tested. The third would be to use a condom. Fourth would be test regularly. Fifth would be get vaccinated. Sixth would be don't engage in sex while not sober. The last is obviously to use proper restriction and care if ever around anyone's bodily fluids. And then the data, so the most contracted, so it's going to be HPV, trichomoniasis, chlamydia, HIV, gonorrhea, syphilis, and HBV. So this shows the prevalence versus the incidence. Prevalence means the estimated number of infections in total, and the incidence would be the number of new infections. So HPV, as seen in the last chart, is the most common. Here's just some information about HPV, what it can cause. It can cause cervical cancer or genital warts or any other STD symptoms. HPV vaccination should occur around 11 to 12 years old, but can occur from age 9. No approved HPV test to find it in the throat or mouth, but screenings for women above 30 to find HPV. There are those certain screenings that women take to find it, along with cervical cancer. And in 2018, there were 43 million HPV infections and 13 million new HPV infections. So some of the treatment, there's tests, 3 different kinds of tests. There's blood tests, urine samples, and fluid samples. And then there's also screening, which is like a test for someone with no symptoms to screen for certain STDs. Medication you could take are antibiotics and antiviral drugs. And then obviously you should notify partners if you test for an STD positively, so that it doesn't spread further, and that's part of the prevention and treatment as well. And then this year's update, revised CDC guidelines. So in 2021, the CDC updated their guidelines for STDs, updated treatments for certain diseases, certain risk factors for pregnant patients, testing, recommendations for vaccinations, and then certain recommendations for Hep C testing. And then these are my resources.